Hi, this is Colin Hung, today coming to you from HITMIC, the Healthcare and IT Marketing Community. And I'm sitting down, or very privileged to sit down with my friend Jane Sarasohn-Kahn, who's going to be talking to us about a few things related to the award that she just recently won. She won the 2020 Medici HITMIC Award for Health IT Advocate of the Year. Jane, welcome to the program.
Colin, I'm happy to be with you, particularly because I get to see you, and I've missed you so much in this coronavirus era.
It is so true. I mean, we normally would have run into each other at least a couple of times by now at the various conferences, or I would have been sitting in the audience listening to you speak, which I do enjoy doing. But of course, that's all different now because of the coronavirus.
It is. So thank you for inviting me on your show.
Well, thank you for being here. So let's maybe give some of the audience a little bit of background. Jane, what do you do?
My own family wonders sometimes. So the little haiku is I advise, I speak, and I write. And underneath that, how do I do that? I do lots and lots of research. I read everything, you'd be surprised, from The Economist to the Financial Times every day, to Rolling Stone magazine and People, and lots of industry publications, obviously, and lots of Google alerts every night. Andre Blackman, our great friend, mind of Andre, founder of Onboard Health, coined me the trend weaver about 10 years ago. And that's basically what I do is I take this mosaic of lots of bits and bits of data from mothers upset about EpiPen prices a few years ago in People magazine to looking at what PBMs were pricing epinephrine at, and I weave all that together for my clients who span the healthcare ecosystem and advise, and I write in my blog at Health Populi, and I write for pay. White papers with my name on them and the company's name on them, so it's very transparent. My point of view, never edited by the client. And then I speak a lot now, in the pre-COVID era, live, and now we're doing so much this way, go to meetings, Zoom, Google Meetups, Google Hangouts, and Microsoft Teams. And increasingly, I'm using cool things like Miro, using virtual Post-it notes. So I continue to learn on these new platforms too.
I was just going to ask you, like, I mean, first of all, I am always fascinated by the connections you make and the trends that you do weave together. That is probably the most accurate description of what you do, that you are a
Yeah.
trend weaver. But how do you do that? I mean, and you just mentioned sort of this Post-it note thing, but is there a sort of a method to how you make those connections?
So there are two genetic gifts that as I age and think back, how did I get here? That great David Byrne song, Once in a Lifetime. How did I get here? There are a lot of writers in my family, going way back to a man who migrated from Eastern Europe named Kazriel Sarasohn. I don't think I've ever mentioned this on any interview, but Kazriel was the founder of the first Yiddish newspaper in New York City, the Jewish Daily Forward. And there are a lot of Saracens with the H, S-O-H-N, who I'm related to distantly and some first cousins. The editor of the Oregonian, David Sarasohn, Sarah Sarasohn on NPR. Those are not first cousins, but they are related all through Kazriel. So there's a writer's gene, and somebody who's obviously given us DNA from a long way back, ancestry.com style, to gift us with some facility of being quick about writing. So I write my blog almost every day, and it's not that it's hard for me. It just is something that comes. So there's that competence that I think is a DNA thing. And the other thing is a brain thing, where, in my private life, I like to paper craft and make collages and take images, and I journal almost every night. It's my therapy. Cut out things, paste them in, like you did as a kid, or like Matisse did with his great paper cutouts. And you in Toronto, you've got a lot of great Matisse in your museum, in your modern art museum, which I miss. Is it the Art Gallery of Ontario?
Art Gallery, Ontario. That's right.
Sorry, art is a big part of my life. But I mean, that's sort of the way my brain works, is I do make those connections. And there's that scene, if you remember the movie Working Girl with Melanie Griffith and Harrison Ford, in the elevator, the lift at the end, where they're with Mr. Trask. And he challenges her, how did you come up with the idea of Trask Media, blah, blah, blah. And basically she talks about what I do. She rips the page out of the society page, and she reads an article in Fortune, and so on. And that's the way her brain worked to put together that deal for his big merger. So, I mean, it really is a brain thing, and how I see things. And I know through my paper crafting, it's the same kind of thing. I don't know if it's a form of ADD. We're not going to give it a name, but it's what I've done my whole life. It's just how it works up there.
I like that collage, the fact that you do them, because it is such a great analogy for what you do with words.
I think I have a journal to show you. I didn't anticipate this, but I created my ABC of COVID early on. And of course, let me just turn to one page to give you an example. And that is that F is for Fauci. And I've got all kinds of things about the great Fauci, including this cute journaling card, hey there, smarty pants. So, and then the Dr. Anthony Fauci fan club pin, and a microscope. So that's how the brain works.
That's amazing. You definitely need to publish that book. That would be a lot of fun.
I'm going to take a week with my husband. Finally, we've decided to be brave and rent a house in the Finger Lakes through Airbnb in August. So the week I'm gone, maybe I'll publish like 4 or 5 images a day that week in advance. I think that's a great idea. Thank you.
No, that is one of the ABCs of COVID.
The ABCs of COVID. I did that very early on when I was very anxious. I've done a lot of journaling about COVID. That's a whole other conversation.
So let me ask you this, Jane. How did you get started in healthcare? Like, of all the verticals, of all the industries to focus on, what was it about healthcare and health IT?
It was not obvious. Yeah, when I was undergrad at University of Michigan, and all my schooling's been at University of Michigan, go blue, Big Ten. Michigan's my home state. I studied economics and journalism, writing, again, that thing. Not that I wanted to be a journalist ever, it's just I write. But economics always fascinated me, and my father was very involved in state politics in Michigan and blah, blah. So worked in market research after college for a few years, and again in the energy sector, interestingly enough, when we were really worried about oil prices and things like that. And then my mother was diagnosed very young in her life, at the age of 50, with a very esoteric leukemia. And I was very young. And she had a terrible prognosis at the beginning, but she lived 8 years on with a tremendous relationship with a hematologist. And back then there was no chemo. We're talking the 70s. And so long story short, after she passed away in 79 at the age of 58, I was fascinated by the insurance bills that were coming in from Blue Cross of Michigan. And she had belonged to a union. She worked for a school district. And my dad was paying like nothing except the TV and the phone in the room. And I said to him, how is it possible that in the last 13 days of Mom's life, dying at Sinai Hospital in Detroit, which was over $100,000, back then, today it would have been $500,000 at least. Who's paying? So I got my first kind of whiff of something's going on in economics, in healthcare. And my father explained to me what insurance was. So I went back to college. I went back to University of Michigan, School of Public Health, and the Graduate School of Economics. And those days, Michigan did not have a health economics degree, but we forged one between the two departments, and did my health economics work there, and then moved to Philadelphia to take a job with a healthcare consulting firm when DRGs were just being implemented for payment. Anyway, long story. That's how I got it. My mother's health and cost experience inspired me. She's with me on my shoulder all the time and really motivates me to keep going. Even in this COVID era, I think about her a lot because she really worked most of her sick life, except the last couple of years that were too difficult. And so that's why I wear lipstick a lot, which you know is one of my things, even though guys don't usually think about that. But a lot of my girlfriends always say, Jesus, you got lipstick on again, even on Zoom. Because I saw my mother do that, you know, outside in. If you feel like you look good, you feel good. So she's informed that a lot pre Zoom era for me. My whole life, because I've had a home office forever, you know, since I left big firms. 20 years I've been working from home, teleworking. And so I have never not worn pants during the day working. I've always, even when nobody would see me, done my thing. So anyway, that's part of my own brand. But I got into this because of mom and my father's political bent. And then HealthIT, it's you know, part of the journey. I met my husband, fell in love, and he was already living in London then. He's an international banker type, now on the banking technology side. But I moved to London after I married him and worked in the NHS and the private sector as a consultant for Touche Ross, now Deloitte. And so that's when I cut my teeth on IT. In the US, even looking at costs and DRGs, I really wasn't in technology yet. I was working with hospitals, health plans, and doctors' practices, looking at costs and billing. So it was just billing systems. But when I lived in London and in the NHS, they were working on full-scale health IT, early era of EHR, not an EHR, but they had to measure and manage from what they measured because they lived on a budget.
Right.
Isn't that amazing? So in fact, I really learned a lot about health IT working with a company called ICL, which was eventually purchased by a larger company, I think IBM eventually. But anyway, that's where I learned about HIT. And then when I got back to the States in the early 90s, then we started to see the growth of the internet in healthcare. And that's really what I early on branded myself in, the early age of the internet and e-health in healthcare, the early age of Dr. Green and working with Matthew Holt as he was building up Health 2.0 with Indu. And of course, then working a lot with technology companies, even to this day.
That's amazing. And for anyone who knows you and or has gotten to know you, it would not surprise them to learn that you were such a pioneer at such an early age, deciding to create your own degree, if you will, around economics and medical economics on top of that. Because at Michigan, that's an incredible story.
It was early. We had Uwe Reinhardt was young, and Alain Enthoven at Stanford. And then early on, the works of a chap at University of Chicago, Gary Becker, who I eventually met. He had won the Nobel Prize eventually, but he was studying the microeconomy of the home and the family and the role of women in the family. And that microeconomics, the looking in on subsectors of the economy, that's what really excited me. It was applied economics. And so health economics is really applied economics because it's all of those things.
So let's turn our attention a little bit to the award. So you won the award for Health IT Advocate of the Year, which is an award that recognizes individuals who have gone above and beyond in advocating health IT or advocating for the health IT community. And it honors your work in the past year to push the industry forward. That's what the award is for. So congratulations again. I think that deserves a round of applause. Congratulations.
Thank you.
So
yeah,
what was your reaction when you learned that you had won?
Well, first of all, you know, I'm not a marketing and communications expert. That's not my job, not my day job. The writing I do on the blog is free. You know, I write a lot and I give away what I'm thinking about because I want people to know about it. And I have a few people who read it every day. And that's great. So I was really surprised, you know, health IT advocate. I'm definitely an advocate. But of course, I talk about health health, and then what builds health. And of course, technology helps us make health, scale health, get health where it needs to go. But increasingly, we know it's not just about the tech. Now we know about social determinants of health and the role of food and education and a good income and access to health insurance. So when I advocate for HealthIT, it's more for health and then the role of that technology plays to drive health, but not being so sanguine that it's just tech, because it's not. If we don't have good public policy and if we don't really love each other at the end of the day and care about each other, the tech won't scale love. So it's tech and. So that's why I was surprised. One, I'm not a communications professional. And two, I don't consider myself just a health IT advocate. So the fact that you spotted that and called that out, it was gobsmacking. Like, it was lovely. Especially during the pandemic. This award has happened now, a month ago. So I'm grateful, and I'm also just astonished.
Well, you definitely deserve it, and you were. It was a category where there was filled with other people who are great advocates as well. But the work you've done in the last 12 months has been just awesome.
My friends, no, I mean, as the two folks, Matt and Nick in the category, they're my buds. I mean, we hang out. So I mean, and I love them. So anyway, very grateful.
So if you look back over the last year, is there anything from your portfolio or anything that you are most proud of in that past year?
Yeah, I have to say, I got my book published, Health Consuming, which writing a book is hard when you're working and you're living your life and you're traveling and you have your relationships, your husband and your child. Although my child's an adult now, living up in Boston, doing great, and your friendships, But I had to get the book done. It was the time. And now in the COVID era, I look back at the theme of health consumer to health citizen. And boy, again, I think I was just a little early, and that's great because now it's so relevant and resonates right now. And I say that because people I'm speaking with about it are saying, "Oh my gosh, this is happening. Like this is you're prescient that way." And also in the last year, I mean, my blog continues to grow and I love it. And it's becoming more and more the voice of my voice. Like, I feel like it's the authentic me. If you read it, I love it or hate it. And I have haters, haters gonna hate, and it happens, but that's okay. We believe in that. And then I think more recently, just my ability to pivot to the virtual world, pivot a business. And the business is just me, although I've got a network of people I work with. And that was challenging. In February, 3 days before HIMSS was supposed to go on, and we all had our calendars full, and I was supposed to see you and hug you and work with you, collaborate. And your great mixtape that I love to participate on every year. The fact we couldn't celebrate that in person really sucked. And it took all of us, that exogenous shock was really crappy. And so the fact that mental health has been the pandemic in and will be beyond the pandemic, the COVID pandemic, is very real. And everyone I talk to, when we take the lipstick off and our sort of Google face, not our Facebook face, what do we search on? If people knew that, they would know our real selves. It's impacted everybody. But I'm very blessed in that I could pivot a business. I could cook at home. I could go to the grocery store. There are things that I could do. So, but I think that's an important part of the last year, showing our mettle and that we can stick to it and be tenacious and keep working with our clients, supporting our clients, most of the work pivoting toward COVID. So that's been very gratifying too, to help the various kinds of clients that I have provide some sort of value and support for patients and caregivers and clinicians in this just ridiculously long haul of the pandemic.
Now, before we got online here, you and I were speaking about that pivot between in-person or from in-person events now to online. And you've experienced sort of a delay. It didn't happen for you right away where, everyone just said, okay, well, we're going straight from a conference that was going to happen in Boston and we're going to go right to online. You mentioned that it took a little bit of time for some of your clients and some of the people who had asked you to speak to make that move.
Right. So we're business people here. We're for profit for the most part, though we do pro bono work for sure. But the first order of business for all of our clients was, where's the next dollar or pound or euro going to come from? And they had to figure out what's the business model now that there's a shutdown. It seemed incompatible. So there was first managing the treasury function and the income and the sales. And I respected that and didn't get in the way of any of that, and just kept in touch with people that I was contracted to speak with or work with, advise, and kept the blog going, kept my research on COVID up. And I have to say, it's become even more intense in the COVID era, because what COVID is about now, we're looking at, structural racism and more and more of the social determinants in all of that. So it's even more complex doing that trend weaving. But the first thing was clients getting the business in order. At the same time, they had to set up their employees at home in
Right.
telework. And virtually all my clients are in that kind of business where people can work at home.
Hmm.
They're not wait staff in restaurants and grocery workers and people who cut hair. So they're office workers. So they also had to attend to the telework, the setting up of the virtual private networks, many of whom did not have very resilient infrastructure
Infrastructure,
for
right.
people working at home. And then my clients are people who had to set up home offices. I got a lot of those kind of calls early on. Jane, how do you create a home office? Which is what I've had for a couple of decades. So you counted on Best Buy, and which was an essential business in my neck of the woods. You could do curbside delivery for Best Buy, which I did. I've got one around the corner here, and but anyway, and Staples, and of course Amazon. So you had to respect the fact that your clients were people and businesses who had to keep their business going, their sales going. Once they got through that, and for some it took about 3 weeks, for some it took about 6 weeks, but within about 6 weeks, most of my contracted speaking engagements pivoted to online. And that included things like AHIP, the
Hmm.
American Health Insurance Plan Conference, went virtual very quickly. I spoke at that. The American Telemedicine Association conference. Ann Mon Johnson pivoted that virtually beautifully. It was a brilliant conference too, just after AHIP. So those big conferences pivoted to virtual. And then my client, more private work with the C-suite, some of those meetings that would have been in boardrooms or in smaller conference rooms, they often have pivoted now and continue to a more town hall kind of setting, a Zoom meeting with lots of heads, Brady Bunch style, where I'll speak for a little while and then we'll do a Q&A. Lots of conversation, of course, about how COVID's impacting the business, but some looking now into 2021, because we now realize we're not going to be out of this by the fall. And in the summer, when we thought maybe we'd have a break, no. So now that we really understand how long vaccines take to develop, not at warp speed, but at a rational speed, and therapeutics, I don't believe I'll be going to CES live in January in Vegas with 140,000 of my best friends from all over the world. Don't think that's going to happen live, but certainly I'll speak virtually at the Digital Health Summit and/or CES. And then what about HIMSS? We don't know. That's what, March in Vegas? Don't know. So we're going to work this way effectively, and I think we're learning how to leverage these platforms really well, the way physicians have stood up telehealth really well.
Well, I think this is a great way to end our discussion today by asking you the question of, well, other than publishing your ABCs of COVID book, what's next for you in the coming year? What are you anticipating that you're going to be working on or doing in the next 12 months?
Well, I am updating the book, Health Consuming, for the COVID era. And I'm going to do that just as an ebook really quickly. And we're going to stand that up hopefully in August next month. So I've got my designer in Dublin, Ireland, ready to receive the copy soon. The date is changing every day, and I've got to stop updating. So every day new PowerPoints. But the plot line is there. I know who this consumer is in the era of COVID, and this is what I believe I want to get out to everyone now before the end of the summer. And then I'm going to do another very short ebook a month before the American election, looking at health politics and how this is a healthcare election, public health, personal health, privacy, and broadband, sort of my passions. And that I want to inform healthcare voters, particularly industry policymakers, on why, what we've learned from COVID and the politics and the health politics of it. So those are the two immediate next two publications that I'm going to be putting together. And then more of this great work of collaborating on these virtual platforms, and particularly getting this message out about the importance of social determinants and a health policy and policy beyond healthcare policy. It's all about everything. So that's sort of my mission. I'm driven through this COVID era to try to help make things better coming out of it.
Well, Jane, as usual, when you and I get together, we could go on for hours chatting, but we're out of time today on this program. But congratulations again on winning the 2020 Medici HitMake Award. You definitely deserve it. Thank you so much for being on our program.
Colin, thank you, my friend. Lovely to be with you.
This is Colin Hung today, coming to you from Healthcare and IT Marketing Community. Thanks for listening.